Hi class, today we're going to be reviewing data sets and information management. Now since you are all practicing RNs, some of this information you will be able to relate to your everyday practices as a nurse. Let's take a closer look. Data sets and information management directly impact the quality and safety of healthcare that we give to our patients. Data sets are a subdivision of information management. Data sets allow for improved consistency, they increase efficiency, and they allow for data sharing to occur. Data sets capture important information about services received and patient encounters. Data sets also help assess the quality of healthcare, including areas of patient care, administration, research, and education. Healthcare databases are most commonly used to assess the quality of healthcare related to diseases and specific healthcare delivery models. Here's a great visual graphic. Basically, all of the information that we gather, we document, technology today has allowed it capable that data sets can provide accurate and up-to-date information to be collected. Now the information that's collected with data sets we use in information management to provide safer, high-quality care. Data sets are used in various areas of healthcare. We, as nurses, see data sets used as our electronic hospital records, provider softwares, but there are various areas that databases are used. We can see it in the government, geno registries, patient registries, mobile data and wearable collection, medical claims. Now let's take a closer look at information management. What is information management? Information management in healthcare. It is the practice of acquiring, analyzing, and protecting digital and traditional health information. Examples of information management are our electronic medical records and electronic health records, practice management software, master patient indexes, patient portals, remote patient monitoring, and clinician decision supports. Information management includes utilizing tools and systems to provide high-quality care to our patients. Health information management uses records, coding, documentation, policy guidelines, administration, and compliance. Now, these are what we as nurses use daily. We don't always think of it as being a part of the bigger picture when it comes to health informatics. But without all of the steps we do to provide care to our patients, such as scanning the patient's bracelet, scanning the medication prior to giving it, surgeries that occur in the operating room, all the documentation that is start times for the OR, all these little things we document as nurses in various areas can be collected and looked at so that we can improve the way that we provide care to our patients. The ways that information management directly impacts the quality that we give care to our patients. It improves patients' access to their medical records. It ensures safety and privacy of the data that we collect. It also meets HIPAA standards. Data mining to improve patient safety. Data mining is basically the practice of examining large databases in order to generate new information that we need to make better decisions. Analyzing health records for accuracy, creating a standard of language, improving health care through improved coordination. Multiple providers can look at electronic medical records at the same time. I know at the hospital I work at, Many of our surgeons and anesthesiologists will access patient records from home to review their records for the cases for the next day. This is just one small example of how providers can have a coordination of care. It can increase communication with healthcare records providers, surgeons, anesthesiologists, nurse practitioners, nurses. We can communicate with one another, send messages, receive messages from patients. Patients can request medications from home, which is a great tool for them. And it also improves healthcare literacy. Now, how does information management directly impact quality and safety? First, let's look at what quality and safety means to us as nurses in healthcare. The Institute of Medicine defines quality as the degree to which healthcare services increase the likelihood of desired health outcomes. Safety. Safety is defined as a concept that includes all measures and practices taken to preserve life, health, and bodily integrity of individuals. Process of collecting data. Data quality. This is a huge part of information management, the quality of data that's collected, the application of the data that we've collected, the warehousing, the systems we use, the archive data, and analyzing, the process of translating data into meaningful information. All of these aspects of collecting data are what makes high quality data possible. Quality and safety and information management. Healthcare information technologies such as EMRs and EHRs have been developed to promote safer healthcare. Quality and safety education for nurses has focused on the benefits of informatics in nursing and implementing nursing competencies to promote safety and quality in patient-centered care. Utilizing EMRs to care for patients promotes safety and consistency with data collection. This is a huge part of what we do as nurses today. The Institute of Medicine states that improving healthcare management collection improves patient outcomes. The final thing we're going to look at is the direct connection to quality and safety and what we do on a daily practice. First, I want to discuss how important it is that we have accurate information. When we're discussing quality and safety, especially within the healthcare system, we must also discuss the importance of high quality data, the methods of collection, quality improvement initiatives, high quality benchmarks, the importance of capturing data, collecting data, and analyzing it. Now, we're not going to go into further discussion, but I did want to mention these aspects of quality and safety. When we discuss quality improvements, if you've ever been able to have the opportunity to see what quality improvement does at your healthcare system, these are some very important aspects that they look at when discussing quality, and also the quality of the data that's collected. But today we're going to discuss how information management impacts the quality of the care that we give. Using the information provided, we can utilize management tools to promote patient safety and a higher quality care. This graphic I really like. These are all the outside factors that impact a culture of person or patient-centered quality care that continuously improves. Measurement for quality, use of improvement methods, staff engagement and understanding of the tools that we use, person and family engagement, leadership for quality, governance for quality. These are all outside factors that directly impact the care given to patients. data sets and information management are all utilized on these outside aspects to directly impact the care provided. Adapting practices, benchmarks, and protocols are the outcomes when we look at information management. This is a great graphic to help understand the impact of data sets and information management. The data collection occurs, transferred to data collection systems. It then is analyzed. Information is provided, regular reports. This information usually is given to administration management. Knowledge can be used here when assessing the reports that we receive. And hopefully this part of the data collection process is when we use the wisdom and knowledge that we have as providers to directly impact the care that we give to our patients and improve that care. Now this is a brief overlook at data sets and information. I hope today you've learned a little bit more about what you do every day in your practice as nurses directly impacts the information that hospitals that we work at, the doctor's offices we work at, how data sets and information management can be used. Thank you so much, class. I hope you have a great day.